It's citizens first, and that's what our money has to go for. That has to be the priority.
That is State Senator Terry Bryant yesterday reacting to some of the conversation around the federal big, beautiful bill that the U.S. House narrowly passed. Now the U.S. Senate can pick it up, but the measure that is President Donald Trump's major initiative, they're looking to get that done before July 4th. It's Illinois in Focus Daily. I'm Greg Bishop. We're going to look at just a little bit of the reaction of what could be the final outcome of the big, beautiful bill, so to speak, and just a couple of aspects of it. And in particular, this quick flash here we've got as the Senate works on their side of it. We'll see what ultimately comes out in the wash at the end, but the federal budget impacts the state budget. The federal budget impacts Illinois taxpayers as well. So it's important to kind of see how that's going to interact with whatever state legislators are doing at the state capitol. So Thursday morning, we hear the U.S. House passes the big, beautiful bill. Donald Trump's key initiatives extends the 2017 tax cuts that he had for his first term. It does also things like no tax on tips, no tax on vehicle financing, no tax on overtime. So, I mean, all of these different initiatives that the president campaigned on seems to be working its way into the bill. But there's also other things, like, for instance, trying to control federal tax dollars when it comes to using Medicaid for non-citizens. And that's something that Illinois does. It's something that California does at a much larger cost, and other states are doing it as well, using your tax dollars to subsidize the health care coverage of non-citizen migrants in the country, be it they here illegally or here as an asylum seeker or whatever the case may be. Those individuals, at least in Illinois, they can take part in certain programs and get health insurance subsidized by the taxpayers. So we've had this program in place in Illinois, but now with this, quote, big, beautiful bill, those dollars from the federal government could be going away, which would mean a higher cost for Illinois taxpayers. And late last month, we had an organization that was promoting what they call progressive revenue, and they talked about how they need to do all they can to help the migrants community in Illinois. You have one particular advocate, Asians Advance Executive Director Grace Pye, saying that they were anticipating federal cuts to migrant services, and they said we need to increase taxes in the state of Illinois.
At a time of intense xenophobia and attacks on federal funding impacting immigrant communities, we think it's really important for the state to step up and meet the need that is there in terms of providing health care for immigrant adults.
So are they going to, before the end of the month, find more revenue for the health care for immigrant adults, which the governor looks to get rid of after seeing the costs? And we had that audit showing that there were cost overruns and internal reporting errors, like people who shouldn't have had Social Security numbers having Social Security numbers, taking part in the program, getting taxpayer subsidies. Since the past 3 years, it's cost $1.6 billion. So what if this big, beautiful bill from the federal government, Trump's initiative, goes through and limits those tax dollars coming to Illinois to pay for non-citizen health care coverage? Well, the Kaiser Family Foundation found that it could mean over the next 9 years, Illinois could be on the hook for $10 billion in such costs. State Senator Terry Bryant got her reaction yesterday at the Capitol to kind of say, what are we looking at with this big, beautiful bill from her understanding and how it's going to impact this particular issue of non-citizen healthcare subsidies.
Yeah, so I think what we're going to see from the federal government is a clawback, if you will, not necessarily grabbing money from Illinois, but clawback of the ability that we have to fund immigrant health care. And in particular, I've been super opposed to illegal immigrant health care because I think we should put our citizens first. So in this case, the federal government looks like they're going to be saying, you can do it if you want to, but you'll be paying for it yourself, which once again pushes it back on the Illinois citizens to pay for illegal immigrant health care. And that should not be a priority for Illinois. Our citizens should be our priority.
So you've got Bryant talking about the citizens of Illinois should be the priority, not non-citizens living in Illinois. Governor J.B. Pritzker posted on X before the vote on the big, beautiful bill. I don't know why we keep calling it that, but that just seems to be what sticks, I guess. Trump has an interesting way about words. But Governor Pritzker posted on X that if this passes, it's going to lead to the loss of healthcare access for hundreds of thousands of Illinoisans. And he says, what's big and beautiful about that? But Bryant saying that this should, boost the governor's initial proposal earlier this year to get rid of the health benefits for immigrant adults program. And that's people from 42 to 64, I believe. The seniors program would still be intact in the governor's proposed budget. And that would be any non-citizen over the age of 65 could apply for access to this healthcare subsidy from the Illinois taxpayer and the federal government as well. But that might be a ticking clock. So Bryant says that the governor should end the programs.
Well, he says that he wants to, but he's not so far actually implemented that. Even the position of dialing it back didn't really effectively start until July 1. So I guess we're going to have to wait on that dialing back to see if it actually does happen. But I think a lot of, when you look at someone's budget proposals, it says a lot about what their priorities are. And Governor Pritzker's budget priorities still seem to be heavily weighted towards those who are non-citizens. They need to be on the citizens of Illinois, especially if the federal government makes cuts to Medicaid. If those Medicaid cuts are made from the federal standpoint, we may have to pour more money from Illinois into those programs to meet the needs of our own citizens.
So Bryant saying that the governor should end the program as he said he would in his budget, proposed budget in February of this year. But you've got a lot of people pushing back. The Illinois Coalition for Immigrant and Refugee Rights, ICIRR. They were supposed to hold a news conference yesterday. It was on our calendar to cover it. And they didn't go to the press room during their scheduled time. So didn't get a chance to hear from them. But as I was talking with Terry Bryant, I was fully anticipating ICIRR holding a news conference. And I asked what she would tell them if she had a chance to sit down and chat.
I would say to them, citizens first. I've often said, I'm an evangelical. I believe very strongly in meeting the needs of people. If they need clothing, if they need a place to stay, but they have to go back out of the country and come back in through the front door. Happy to keep them safe until we move them out. But whatever they're saying downstairs, I don't know. But I know this. It's citizens first. And that's what our money has to go for. That has to be the priority.
So again, Terry Bryant saying that citizens first must be the priority in the tax dollars that are used. So that's just one aspect of the, quote, big, beautiful bill that could get onto the president's desk before July 4th, dealing with taxpayer dollars for non-citizen migrant subsidies. The other issue that really surfaced for me in my head and its impact on Illinois, and there's going to be tons of other things about this bill. It's 1,000+ pages, I think. People obviously are going to be picking all kinds of stuff out of it. The shoring up spending on food aid, for instance, the shoring up spending on Medicaid, for instance. But another issue that's going to impact Illinois would be the state and local tax deductions. So in Illinois, it's a high tax state. I think that all different kinds of organizations recognize this, from the Tax Foundation to Wallet Hub to everything in between. Illinois is among the highest tax state. We've got the second highest property taxes. We've got among the highest combined tax impact. You've got high corporate income or high corporate income taxes as well. One of the things is Illinois is a high-tax state. New York's a high-tax state. California's a high-tax state. SALT, the state and local tax deduction, is for the federal tax filers. If they have a certain threshold they meet, they can file to have their SALT deducted from their federal income taxes. I believe right now it's at $10,000, and this particular bill would increase that deduction threshold to $40,000, which would be a good thing for people in high-tax states like Illinois. Now, yesterday, House minority Republicans, they held a news conference with like an end-of-state House session preview, saying that there needs to be structural reforms, but I asked State Representative Ryan Spain to talk about the SALT deduction issue that could be in this, quote, big, beautiful bill.
Well, thanks for that question. I'll talk about SALT first. I mean, I think it's a favor being done to high-tax states like Illinois. I always find it interesting in the national discussions about SALT, and we eliminated almost all of the Republicans serving in Congress for the state of Illinois. We only have 3 left. But New York and New Jersey and California, this group of so-called SALT members of Congress, talk about making sure that deductions can be restored up to now $40,000 for property taxes, state income taxes, and so on. Yeah, I mean, that's a generous benefit to the people of Illinois, who have the second highest property taxes in the country behind New Jersey. I think what I was trying to say, I'm surprised Illinois is not mentioned in that conversation more often alongside those other states, because we have the overall highest tax burden, state and local taxes, of any state. So I think as a policy initiative, perhaps that keeps some people here in Illinois, but we have to understand that for regular working families, it's the preponderance of other policies of the state of Illinois that are chasing them away. And so I don't think Congress is going to save the day for us, and we need to continue to work to shield the taxpayers. On the Medicaid side of things, the big, beautiful bill, we're waiting to see what the effective dates are for different provisions. Even the Medicaid work requirements that were introduced and accelerated still don't kick in until the end of 2026. So the state of Illinois has a lot of time to understand what would be impact from the big, beautiful bill, I'll call it budget reconciliation instead of big, beautiful bill. And we can make adjustments. There's all this discussion about the legislature would be returned sometime this summer to respond to reconciliation and what the budget impact would be. I think that's pretty silly, considering nothing will be effective immediately. We'll have a lot of time to adjust and adopt. And as we've been involved in conversations within the Medicaid space, we know that as drafted, some of the work requirements, work requirements is a term of art that I think probably should be crafted a little differently. Work requirements could mean working 20 hours a week, or volunteering, or being a student. So I think that there's a lot of latitude, and we'll continue to learn more about that.
So again, the big, beautiful bill. A lot of unanswered questions because it's not finalized yet. Like Illinois. We'll be watching, clearly. It is Illinois in Focus Daily. I'm Greg Bishop. Like, subscribe, hit that notification bell. I got to get back to the Capitol today because they're back at it. At least the House is in session. Will they get together a budget? Probably wait for that to see what happens next week after the Memorial Day holiday, but the Senate's not in session. They're coming back Monday evening. Yes, Memorial Day evening. So I'm going to have to head to the Capitol. I thought I had Memorial Day plans, but I guess not. But we do have some action at the Capitol today. We'll have to talk about that early next week, including at some point later on this morning. Looks like we've got a possible news conference with Senate Democrats, so we'll see what they have to say. Again, Illinois in Focus Daily, right here each and every weekday morning. Get the newsletter in your inbox. Go to thecentersquare.com. Find that today, and also get the podcast, Illinois in Focus, every morning right here with the Center Square.